been down to your place. She has a wonderful display at the swap meet booth 13, B13. And I've been there and I've watched all sorts of people come and go and buy all of different accessories. Deborah V., thank you for this wonderful display in our world of fashion, and we hope to see you many, many times again.
Thank you.
We'll be bringing you now some marvelous health tips. So, getting right into our health and beauty segment as promised, with us today is a return visitor, Dr. Kathy. This is Dr. Kathy Wagner. Why is she one of our favorite physicians? Because she's most unusual. First of all, if you are her patient, and if you get very ill, believe it or not, she will come to your home to tend you. You don't find that anymore. A doctor who makes house calls, indeed. And she has some other things that are marvelous that she does, like she's into acupuncture. Everybody loves it. Telling it right?
That's true.
And hey, I'm talking too much. You take it, doctor.
Okay. Well, I'll just tell you a little about my practice. Pioneer Family Medicine, located at Rainbow and Sahara.
Oh, okay.
Rainbow and Desert Inn. Sorry
That's
about
even
that.
Better.
That's right.
Better location.
It is. It's a good location, and I am focused on health rather than illness. Although I'm happy to take care of people.
What do you mean by that?
I'm trying to help people maintain their health in good status. So I do some nutritional counseling. I'm very interested in herbs and supplements. I do acupuncture, both to treat illness, pain, menopause, and also just to balance people out.
Is that for men and women, or just women?
Yes, I actually have always had a large women's health practice, but many men are dragged in by their spouses and partners, and I enjoy taking care of them as well. In addition to treating whatever illnesses come up, I'm very interested in troubleshooting and preventing things from happening, offering people the usual surveillance for cancer and heart disease that are recommended, and helping them to live healthy and happy lives.
In a nutshell, if I were to ask you, how could you really, as you just said, prevent something horrendous happening to you? What would you say?
That is such a good question, and I think my patients who are most progressive are very interested in that. I think the most important thing to do are the things that your grandmother told you to do. Eat well-balanced food, consume other substances like caffeine and alcohol in moderation, stay very well hydrated, which is a big issue here in southern Nevada.
Why?
Because it's such a dry environment. People walk around in a mild state of dehydration all the time, and get regular exercise. If we had a pill that did for us what exercise does, everybody would be taking it. I think that we can use judicious use of vitamins and supplements to maintain our health. And if people would do that, then there would be fewer sick visits to the doctor.
What about people who have cancer, certain forms of cancer, like
Yes.
perhaps cancer of the bladder?
Mm-hmm.
And what do you think about them taking herbs to help? What do you think about that?
Well, I think that there are certain herbs that have certain functions called tonics, that there are herbs that sort of build things. They build you up. They are nourishing and nutritive. We don't really have substances like that are medications in our culture. Chinese and Asian cultures have a lot of those. So I actually am very supportive of that. I also am a Western doctor by tradition, so I actually use
best of both worlds.
Exactly. I do not tell people treat this cancer with herbs, because I think that we should use
You
absolutely
would say,
the best.
try this because it just may be helpful.
Right. Or use it as a complement. So
Yes.
if somebody is undergoing cancer chemotherapy or radiation, I would support them through that. I wouldn't give them anything that would make that less effective. But then usually in the follow-up, I would use acupuncture to build them up. Some vitamins.
How do you build up with the acupuncture?
Well, you can work on the immune system. There are certain points called alarm points on the back and on the front, and you can work on whatever system is having symptoms. So if it's the bladder, There are points actually in the bladder or on the bladder channel, which runs up the back, that you could actually use to make people feel better and to make, I can't say it makes the cancer go away, but it certainly helps the body reinforce.
It wouldn't hurt, doctor.
It wouldn't hurt, that's right. And one of the things I like about these medications, herbs, supplements, and acupuncture is the risks to the patient are low and the yields can be very, very powerful.
You know, that is so interesting. You don't hear very much about acupuncture, and yet, as you said, the Orientals have used it for, what, hundreds of years?
Thousands of years.
Thousands of
3,000 years.
3,000 years, and yet it's like the best kept secret
Yes.
in America.
I think that there are patients who are very interested in this, and there are actually many physicians that are adding acupuncture to their treatment regimens, either recommending others to perform it or learning it themselves, as I did, because it actually adds so much to what you can offer to the patient. I practiced for 10 years, and I had the realization that there are so many people, maybe up to 1/3 of your patients, you can't fix them, you can't help them. So I'm very interested in actually delving into the spiritual realm, because I really think that in terms of healing, that may be where the action is.
Alleviating in whatever manner you can.
That's right.
That's
right.
Wonderful. You are some hellacious kind of physician.
Right.
And, you know, and she's a cute little thing. You are, look at her. Would you think that this is such a healing physician? I think you're wonderful, Dr.
Well,
Kathy.
thank you. I'm not really looking for the cute moniker, but
but you're stuck with it.
Right.
Kid. Well, Dr. Kathy, what would you say, what kind of doctor are you?
I'm a board-certified family physician, and in addition, I've completed extra training in obstetrics. I do a lot of women's health, and then I consider myself an integrative or complementary physician because I do some of these other things.
And you do also take care of men.
Yes, I do. I enjoy taking care of men.
Oh, don't we all, darling?
Oh, yes, we do.
Well, I think you are delightful, and I think you're overwhelming, and I think everyone out there should give you a jingle. See if I remember your number.
Okay.
Got it, gang?
Jintsy.
Dr. Kathy Wagner.
Thanks very much.
Thank you, darling.